Have you ever used an electronic health record? Have you ever considered how the information that you put in it affects the end results, whether it's completing your plan of care or getting to the patient? Have you ever used one of these systems and thought, this system could be better? Well, if you have, you're like many nurses who have used an electronic health record or an electronic medical record and found that sometimes, while great and a good resource, it oftentimes might be lacking some very vital information. Hi, I'm Carolee, and I'm an APP stroke coordinator and have been doing so in South Florida for several years now. And in my tenure, I've had to collaborate with many different members of the interdisciplinary team. And one of our biggest assets that we use on a day-to-day basis to be able to help us and support us in the providing of this care is the electronic health record. But oftentimes we wonder, is it doing enough? Is the information that we are receiving from these electronic health records and what we're putting in, is it viable? Is it really working to its highest potential? Is it allowing me as an APP to be able to effectively communicate what the assessment and needs of my patient are? And how can I even better help support this patient once they've been discharged from the facility? I find myself sometimes thinking these systems could be better. How are they really supporting me? Should APPs be brought to the table with developers to consider how these interfaces are being built to actually better support us so that we are actually collecting meaningful information, obtaining meaningful data that empowers us and enables us to not only communicate better and collaborate with our interdisciplinary teams, but formulate objectives and plans to really better support our patients. In my role as a stroke coordinator, I, along with the providers that I work with, depend highly on the electronic health record. In one way we depend on it is with obtaining images of the patient's brain to decipher, is this an ischemic stroke or is it a hemorrhagic stroke? We also collaborate with putting in information that really paints the picture of what the patient is experiencing so that we can better manage this patient's symptoms. As I work at a primary center and sometimes have to transfer my stroke patients out to a comprehensive center, depending on the needs, it's important that the information that is entered in this computer is viable and efficient for use at the other site, which is our sister facility, who also shares the same EHR. It is clearly understood that if good information is not entered into the system, oftentimes we tread the fine line of a patient having a negative outcome or even a delay in care. And then further down the line, when we look at our outcomes and we've collected data that has all been entered into the system, is it actually giving us a clear picture of how well we did, where we needed to improve, and also points to the things that we could work on to make ourselves better for our patients and the team that we serve. Today, I stand before you and I implore our program and app developers, our administrative leaders, and our APPs and nursing team leaders to really push and advocate for APPs across the country and across the world to be a part or be at the table for the development of our electronic health tools. As APPs are subject matter experts with experience not only in the clinical but in the data management and play a vital role in communicating and collaborating with the interdisciplinary team, we have so much to offer to develop these tools to make functionality and efficiency better for nurses and APPs and healthcare systems across the world. Now let's first consider what are the effects of a poorly executed electronic health record or medical record. While electronic health records are not a new thing and have been around for many years, a properly executed development can actually lead to better efficiency and management of our patients. A negatively executed or a poor electronic health record or tool can actually lead to many patient safety risks, which might include medication errors, improper identification of patients, delays in care, miscommunication, all which might lead to communication breakdowns, which might affect the overall care of the patient. So again, we ask, how is we as APRNs be able to support the development of these tools? As APRNs, we understand the day-to-day life of the bedside nurse, because most of us have definitely traveled that path at a point in time. And we understand what the role of the provider is, the individual who is responsible for assessing and understanding what is happening with our patients and helping them to make the appropriate medical decisions to achieve optimal health. Using this, using the APRN with the development of these tools, we can now elicit techniques and tips to reduce the occurrence of medication errors using things like BCMA, thinking about the process that the nurse or the team has to go through with proper med administration, and present areas where that might reduce the risk and harm of improper medication use to a patient. We can also discuss how effectively to identify patients. Have we caused too many steps in the process to make sure, or are we not doing enough? As an APP, we can develop roles and tools needed to effectively and safely, per best practice, to make sure that we are identifying our patients, therefore further reducing delays in care and reducing possible misinformation that can be shared from team member to team member, interdisciplinary team to interdisciplinary team, that can also result in a major negative outcome for our patient. Overall, using the knowledge and the expertise of the APRN, developers may be able to better understand essential elements of the assessment and the day-to-day workings of a caretaker, and enable us to better provide clarity in all our clinical processes to make ourselves and our practices more efficient and safer for our patients. Another important area of focus is data accuracy. We put so much information into our medical records. From the moment a patient enters the facility, we are consistently and constantly capturing different data elements, from patient demographics, where this patient lives, if they have insurance, what their family structure is like, what their educational structure is like. Also, what about our assessments? There's so many things, depending on the specialty, that is collected to better understand the patient, their condition, and what the next steps for treatment are. With all this going into the record, have you ever stopped and actually thought, is this information actually useful? Am I able to do something good with it? Or are we just loading up a system with numbers and information that is never really used, that's never really looked at, and really doesn't help our patients? What about the situation, which I often see as a coordinator? There's so much to document. Do we sometimes develop negative behaviors that cause members of the team to just cross the T, dot an I, enter information to close out a screen, but not really truly capturing what is happening in the clinical picture, which we know can be very dangerous, could definitely affect the outcome of the patient. As an APP, being brought to the table now enables us to have a voice in discussing what is needed during our assessments. If you work in a specialty area like me, we can actually have a discussion of, what does the neurological assessment look like? What information is vital to be captured to better support not only our patient, but our team? Remember, a lot of the information that is being collected is helping members of the clinical team develop a plan to best support this patient. If the information is not sufficient, then we possibly could make a mistake. Now, at the end of this data collection and entering this information into the record or the EMR, there has to be a time where we actually go back and look at this information. And we have to make a decision on doing something with it and making it meaningful. Of course, this is where we have the implementation of performance improvement plans. If the goal was to have thrombolytics initiated within 60 minutes, and we can't effectively capture what happened during the time of the assessment or during the time of treatment that has pushed us out of the window, it is very hard to effectively collect information to develop a plan, to actually bring attention to what did not go according to plan. Allowing the APP to now have a part in the development of these tools actually gives us the opportunity to really think about how are we collecting data? What data points are vital to us and the team so that we can actually think about what do we do next with this information, or what would I like to do with this information? The other major part about the EHR that I find to be the most important part is communication. How does this tool allow me to communicate with my providers or with other members of the team? At some point, we've all possibly used an SBAR. And I like to say an SBAR is probably only as good as the information we put on it. So if it doesn't trigger the nurse or encourages the nurse to really paint a good clinical picture, are we actually hurting ourselves and the team? In an interview that I recently did with an APP, one of the things that came up was the providers or the physicians not having enough confidence in the nurses or the APPs on the team. But what if we could create a tool that really focuses on prime information that needs to be transcribed to our team members to really build comfort and confidence in the team that the information that's being given best reflects what is happening and what is being done with the patient, and also allows us to effectively communicate needs, concerns, and opportunities with the rest of our team. We're always looking for a positive outcome, which is always going to be the end goal. But what if we're able to now use our communication tools built in the EHR to really identify when something is not working in our favor? How do we do that? I think as an APP, we're able to actually sit at the table to make sure that we are communicating with the team to say, hey, this is what's happening with the patient, and this is what needs to be done. This is now going to be able to build a camaraderie, respect, and confidence within the team that each individual that follows the algorithm or uses the tool that's developed can effectively communicate needs and actually support the patients the way they need to be supported, as well as the team. I like to think back to a time when I first became a stroke coordinator, and I sat in front of the electronic health record that we had at our facility, and I really wanted to understand all parts of the neuro exam. While on the floor as a regular bedside nurse, I remember hearing nurses oftentimes saying this was a tedious job. There were so many boxes to check and so many things to click. It just became a tedious task. Becoming a stroke coordinator, one of my biggest concerns was this really the feeling and the consensus of every nurse? Because if the information that was being put into these records really didn't paint a picture, or we were just clicking boxes and selecting things just to get the task done, how much harm could we possibly be causing our patients? As an APP, I often wonder, and because I very much depend on the assessment of the nurses to be able to formulate my plan and make decisions to best support my patients, as well as collaborate with the practitioners that I currently work with. How strong is this information? As APPs, we have the power, the knowledge, and the voice to really bring forth information based on our expertise to really improve these EHRs. Poorly developed EHRs can compromise patient safety, It disrupts clinical flow, introducing communication breakdowns when most necessary, as well as it introduces data integrity challenges. We can't even understand or make use of the information that's being put into our systems. This ultimately may affect how we process, improve, how we communicate, and really execute implementations to better support our patients. This can have lasting, significant consequences not only on our patients, but our healthcare systems and us as providers. I ask and implore all EHR vendors creating these tools that will be used in medical facilities, hospitals, doctors' offices, to really consider who the individuals and the end users are of these programs. Bring us the APPs, the clinical users of these systems, to the table to help support and better understand what is necessary, what is important, and our workflows that we go through on a day-to-day basis to really improve when we develop these programs, to really have successful and programs that really capture the best clinical picture of what's happening with our patient, as well as allows for us to really participate and effectively communicate with our peers so we provide the best possible care for our patients. Thank you for listening today. This is my TED Talk.